Which of the following cranial nerves is not involved in the sensation of taste? A. The vagus nerve, cranial nerve 10. B. The trigeminal nerve, cranial nerve 5. C. The glossopharyngeal nerve, cranial nerve 9. D. The facial nerve, cranial nerve 7. The answer is B. The trigeminal nerve, cranial nerve 5. The sensation of taste is carried to the brainstem by 3 cranial nerves, the facial nerve, CN7, the glossopharyngeal nerve, CN9, and the vagus nerve, CN10. The facial and glossopharyngeal nerves both communicate sensation from the tongue, while the vagus nerve transmits sensory information from the epiglottis. The trigeminal nerve, CN5, is not directly involved in the sensation of taste, though there is evidence that it is involved in the senses of heat and coolness experienced while eating spicy or minty foods. In addition to the tongue, epiglottis, and pharynx, taste receptors are located in which of the following organs? A. The testicle. B. The pancreas. C. The lung. D. All of these are correct. The answer is D. All of these are correct. In addition to the taste receptors in the mouth and pharynx, taste receptors are located in many other areas of the body. These including the lung, which has taste receptors for bitter flavors, possibly as a mechanism to protect against airborne toxins, the pancreas, the small intestine, the stomach, the brain, and the testis. While the function of taste receptors in the testes is not well known, some research indicates that testicular taste receptors may play an important role in male fertility. Which of the following tastes is not associated with a G protein-coupled receptor? A. Bitter. B. Salty. C. Umami. D. Sweet. The answer is B. Salty. Sweet, umami, and bitter taste are all correlated with receptors for guanine nucleotide binding proteins, also known as G proteins. Taste bud receptors that transmit information about saltiness are triggered by sodium ion channels in the cell wall. Which of the following is not a form of lingual papillae? A. Stratified. B. Foliate. C. Circumvallate. D. Fungiform. The answer is A. Stratified. The 4 types of lingual papillae are fungiform, mushroom-shaped, filiform, thread-like, circumvallate, and foliate. Filiform papillae are the most numerous, covering the majority of the anterior 2/3 of the tongue. Fungiform papillae are scattered along the surface of the tongue, but are more concentrated on the tip and sides of the tongue. Foliate papillae are located on the sides and back of the tongue, and circumvallate papillae are the large, round papillae visible in a row on the posterior aspect of the tongue, just anterior to the foramen secum and sulcus terminalis. Which of the following triggers sour taste receptors in taste buds? A. Sodium ions. B. Glutamate. C. Hydrogen ions. D. Gustdusen. The answer is C. Hydrogen ions. Sour flavor taste bud receptors are triggered in the presence of hydrogen ions, thus acidic foods often have a sour taste. Sodium triggers receptors for salty flavor, while glutamate and gustdusen, a guanine nucleotide binding protein, or G protein, are associated with umami, sweet, and bitter flavors. Which of the following is the most superior vertebra of the spine? A. The atlas. B. The dens. C. The axis. D. The coccyx. The answer is A. The atlas. The most superior vertebra of the spine is the atlas, or C1. This bone sits on the axis, or C2, over a bony process called the dens. The coccyx, or tailbone, is part of the sacrum. How many cervical vertebrae are in the human spine? A. 5. B. 6. C. 7. D. 12. The answer is C. 7. There are 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. The mnemonic for this is breakfast at 7, lunch at 12, dinner at 5. What bone forms the most posterior and inferior part of the skull? A. The ethmoid bone. B. The maxilla. C. The occiput. D. The sphenoid bone. The answer is C. The occiput. The occiput is the inferior and posterior bone of the skull. It wraps under the bottom of the skull and forms the base on which the head articulates with the spine. The ethmoid bone and sphenoid bone are housed primarily within the skull, and the maxilla forms the upper jaw and part of the orbit. What is the name for the bony protuberances at which the occipital bone articulates with the atlas? C1. A. The onion. B. The external occipital protuberance. C. The external occipital crest. D. The occipital condyles. The answer is D. The occipital condyles. The bony protuberances at which the occipital bone articulates with the atlas, C1, are the occipital condyles. The external occipital protuberance, external occipital crest, and onion are all part of the occipital bone and serve as the attachment points for various muscles and ligaments. What suture joins the frontal bone to the parietal bones? A. The parietal suture. B. The coronal suture. C. The frontal suture. D. The sagittal suture. The answer is B. The coronal suture. The suture that joins the frontal bone to the parietal bones is the coronal suture. The sagittal suture joins the two parietal bones together along the sagittal plane of the skull. There are no sutures named after the frontal or parietal bones themselves.